Deep vein thrombosis, or DVT, is a serious condition when a blood clot forms in the vein deep inside the body. When the clot dislodges from where it formed and travels in the blood, an embolism can occur. An embolism is when the clot becomes stuck in a narrower blood vessel elsewhere in the body. Dr. Charlie Hahn explains that these deep leg veins are not the veins that you see just below the skin, nor are they the same as varicose veins.
Deep vein thrombosis, the clots that are located within the deeper vein, usually they're in the pelvis. And those clots can travel to the lungs, which can cause pulmonary embolism. For varicose veins, they tend to be superficial, and those blood clots tend not to travel. They tend to develop blood clots because there's less blood flow. When you sit in for a long time, you kink off those veins in the pelvis, and then the muscle doesn't move as much, so it doesn't pump the blood back into your system. But they tend to develop blood clots, and they do not tend to develop varicose veins. I would suggest they can take some aspirin as prophylaxis if you're medically able, and also trying to get up and move around. As long as you move around, the leg muscle, they're pumping, and they will sort of like acting a muscle pump. They pump the blood back and forth, and that will decrease the chance of blood clots. I would say about sitting like 3-4 hours, and then you get up and walk around at least about 20 minutes, 30 minutes. I see a variety of complaints, and then we have a variety of treatments for the vein patients. They tend to have multiple symptoms and multiple problems, and we have a variety of ways to treat them. And I think nowadays the treatment is evolving, and more than some other traditional medical problems.
You'll find contact information for Veins Florida under the DVT threat story icon on our homepage at yourhometownhealth.com.